everyone. This is Tell All Tuesday, and I'm over the moon excited to be with Dr. Vasiliki Moragianni, and we're here to talk about the secrets to success, getting the insight secrets from your RE, reproductive endocrinologist, and I'm so grateful to that, Vasiliki. You're with us again to give us all this inside scoop, so thank you so much.
Thank you. Hi, Kristen. Hi, everyone. It's great to be back. As Kristen said, I'm Dr. Moragianni. I'm at CCRM, Northern Virginia. CCRM is a Colorado-based practice, which is one of the leaders in fertility care and research in the nation. And now we have a brand new state-of-the-art fertility center in Northern Virginia, right by Tyson's Corner. So we're excited to be starting this great adventure together.
Well, I'm excited for you, but it's still sad for me that you moved away. Because even though we didn't see each other all that much, just knowing you were right around the corner, but I can't wait to come and see the one.
Of course, we can't wait to have you over.
So Vasiliki, we mentioned before that we're starting, Dr. Mark Sklar and I are starting this amazing new offering about what you can do for your mind, body, and soul before, during, and after. And this is so appropriate for us to be talking about your insight, like, to success, you know, just to be able to calm that part, that anxious part that you and I, you know, when we presented together, we talked about that, you know, the medical part and the emotional part. Mm-hmm. So maybe you could address the same thing, talk about, you know, a tip for success for your mind, your body, and your soul from your perspective.
Mm-hmm, mm-hmm. Right. That's why I absolutely always love talking to you, because these are topics that are extremely important. They make a huge difference, and it all works together. So your mind and your body and your soul, as you said, it all works together to make this process work. And we don't often address in Western medicine, or in, you know, we don't often address in our field all of these issues, which is why experts like yourself are so important to work hand in hand with us and help patients navigate this otherwise very difficult and challenging and stressful journey. So we can talk about the medical components of optimizing your success rates and the psychological components. I typically, I talk to my patients, I bring it up. I always ask them how they're feeling in terms of their experience, what they've been through so far. Even if they're in the beginning of their journey, this is very difficult on many levels. The fact alone that they have to come in and talk to their physician about something so personal that should otherwise come much more easily and naturally to them is a great source of anxiety and stress in their lives. And whether it's a partner or a single partner, a couple, or a single patient, whether both members of the couple are on the same page, and typically they are not. These are all very important factors: how they view themselves through the infertility process, how society, their family views them, how they have to deal with it in terms of work, in terms of their everyday life. These are all very complicated factors that play into this. So we talk about all this. I ask them how they feel, how this is making them feel, what their experience has been so far. And everybody has different ways of coping with stress in general and with this particular stressor. And I try to gauge what makes most sense to them. Some patients, they are, you know, the typical type A that needs to feel like they have control of everything, which is, you know, I am like that too. It's very common, especially for young professional people that have had control over most of their things in their life. This is something that makes them feel better about this difficult process. So some patients deal with it this way. Some patients deal with it by taking long breaks in between treatment cycles and trying to cope with it in whatever way makes most sense to them. But either way, I always offer to them the options of speaking to a therapist and having, the way I always present this is I will give you the medical tools to deal with this process, and there's professionals out there that I feel comfortable with that can give you the psychological tools to deal with this. And this includes, again, a therapist or a coach, such as yourself, sometimes acupuncture or Eastern medicine modalities, again, with providers that I am comfortable with and I know what they're offering to patients. So it's safe and does not interfere with our treatment otherwise. But these are all modalities that I have found in the past can make a difference and can help patients cope better with what they're going through. In terms of the medical component of optimizing your success, we need to first address your current health status. So you need, let's say, if we did treatment and got you pregnant today, we need to make sure that you're healthy enough to carry this pregnancy and be able to care for the baby and provide for them as a newborn and be the best parent that you can be medically, both you and your partner. And what that means is making sure you have a healthy relationship with your partner, again, going back to the psychological component of all this, making sure that you're both healthy enough that any issues of chronic medical problems that you have are addressed, any surgeries that need to be performed ahead of time, all these issues are addressed ahead of time, your immunization status and vaccination status is up to date, because there's some vaccinations that cannot be performed during the pregnancy, and I don't want to discover after you're pregnant that you're not immune to some of these infections. Looking at factors such as smoking, alcohol, any drug use. Clearly, none of these are recommended to any extent, but that's where building this relationship with the patient is very important, so we can get to the bottom of this and see if this is a real issue and how it can be addressed. Dietary changes, maintaining a healthy, balanced diet where you are not deficient in any of the nutrients or the vitamins that your body needs to get pregnant and maintain the pregnancy. Making sure that the woman is taking a prenatal vitamin every day, and then any additional supplements that we can discuss on a case-by-case basis. Making sure that some level of exercise is introduced. It doesn't have to be running a marathon or training for a triathlon, but it can be just walking a little bit every day, or taking a little stroll with your partner or with your friend after dinner or before dinner, or whatever works for your lifestyle. And again, we try to talk about all these things, but something that makes you happy, doesn't add more stress, because if you're stressed about working out, then it kind of defeats the purpose. Right. But something that doesn't add stress, it alleviates some of your stress and helps you cope with everything that is going on. Because in addition to your struggle with fertility, the rest of your life is going on. You're still stressed at work. Finances might be an issue, and fertility treatment, unfortunately contributes to that. So just making sure that everything is balanced and healthy as much as possible, making sure that any medications you're already taking do not interfere in any way with treatment, that they're safe to continue during the pregnancy. And, again, a thorough history and evaluation of both partners or of a single patient are extremely important, so that we know exactly what we're dealing with. We maintain a very open communication and relationship, so the patient feels comfortable telling me everything, and I feel comfortable making open, honest recommendations about these issues, because I need to know everything to be able to best help you. In terms of treatment options, there's of course many different treatment options, and in terms of success rates, it completely depends on every individual patient. Obviously, there is some treatments that are more successful than others, but that's where your individual preferences and beliefs and moral and ethical and social compass come in, because I never say this is the only treatment that's available, take it or leave it. We have a discussion. Again, it's the open communication where the patient tells me where they're coming from, and I tell them medically what I recommend, and we meet at a place that they're comfortable with. So it's in terms of treatment, it's the combination of my treatment and my sort of recipe of medications that I prescribe and how I guide them through the process, in addition to the embryology laboratory. And this is something that is extremely important in our piece, in this, as we're trying to put this puzzle together, the embryology laboratory is extremely important. Oftentimes, these are the behind-the-scenes heroes that make a huge difference, but without having a great embryology laboratory, a physician cannot do their job properly, because I rely heavily on them. I take, in the case of IVF, for example, I take the eggs out of the patient, and then until it's time to do a transfer of an embryo, meaning a fertilized egg, I have not seen these eggs and sperm again. They're handled by the embryologist. So again, at CCRM here in Northern Virginia, we're extremely confident in our lab, which is what helps us achieve the much higher than national average success rates, and extreme amount of attention to detail, checking for every little air contaminant or possible air contaminant, or making sure that the position of the incubator is in such a place in the room where it does not interfere with light from the window outside, and how the ventilation system works, and a special air filtration system. Again, it's extreme OCD-like attention to detail, which is exactly what is needed. And if I had my embryo somewhere, I would have them at the OCD lab, where nothing is left up to chance. So this means,
Ricky, I need to interrupt you. I got a call from a woman who is a provider to CCRM lab, and she was telling me that we were having this conversation about people being concerned about the embryologist, or people asking questions about the lab. And you know my story. I'm pretty type A, and I was so concerned about where everything was and who was watching it, and how the embryologist has the same highest standard of care as you do. You're talking about treating the holistic patient. You're talking about treating every part of the patient, and that continues after the retrieval. Because I love that saying that the embryologist is our first baby's babysitter.
Right. That's true.
And that your lab exceeds and does double standards. Even before CCRM uses any equipment, you provide your own quality care.
Right.
Which is above and beyond other clinics. You take that extra step to ensure just what you're saying, that the equipment that you use for the procedures in the room meets your high level of standards. And you didn't even know I had this conversation until this moment, and with this woman who blind called me about this. She asked the question, are my clients discussing what happens in the lab? And are concerned about what's happening in the lab. And I said, well, actually, I think they're concerned about everything.
Right.
And that they put their faith into the doctor, but what you're saying is that you have this behind you, and it is such a reassurance.
Right. And as a physician, it makes my job easier, and it makes me so much more confident when I'm counseling the patient, and I'm telling them I have the utmost faith in our lab, and therefore the success rates and the process will be so much better because of that. Again, it's a very important piece of the puzzle that, of course, our very savvy, knowledgeable patients definitely know about, but not everybody thinks about it. But it's extremely important, because it's probably the most important, if not one of the most important pieces of this puzzle. So
it is, and that's why it's so important to have these conversations. Right. That you need to be thinking of what is the standard of care.
Right.
From your amazing RE, but also from the embryologist. So I'm grateful you brought that up.
No, absolutely. And something that is actually a couple of discussions that have come up very recently, and hot topics are, and this is beyond the scope of what we're talking about, of course, but in the topic of PGS, or pre-implantation genetic screening, and what happens to embryos that are labeled either abnormal or mosaic, meaning I don't know what that means, in between normal and abnormal, and whether you transfer them back. And this is a very hot new topic that, again, a big part of this confusion and controversy stems from the fact that a lot of other labs, or actually I should say in our lab, we have an extremely small chance of calling something in between. So because we are so confident in our ability, and because we run these tests over and over again, and we have extreme amounts of quality control, when we call an embryo something chromosomally normal or abnormal, we are positive about what we're telling you. So then you are never faced with a decision of, did they really mean that it is abnormal and I'm throwing away a potentially perfectly normal embryo, or am I really transferring back a chromosomally normal embryo? So again, and this is just one example, and as I said, it's beyond the scope of this, but
no, I think it's perfect for the scope of this conversation, because there needs, because you're so, speaking from personal experience, you're so overwhelmed by this experience that this is something that you need to also add to the list when you have your initial consult with you.
Yeah.
You know, talk to me about your partner, your embryologist.
Yeah, yeah. No, absolutely, yes. And again, goes back to the communication issue. You should only see a provider that you're perfectly comfortable asking any sort of question to. If you feel like, I'm not so sure I can ask this to my doctor, then this is not a therapeutic relationship. You need to be completely open with each other and feel comfortable asking anything and getting information. And, we are partners in this. You have your partner in life, and we are partners in trying to help you get pregnant. So whatever it takes, we have a two-way open communication that helps answer all these questions. And I think the patients that are the most comfortable are the patients that trust you completely. You need to trust your physician and feel comfortable and confident in their ability and the ability of their colleagues to be able to rely on them completely and relax and enjoy this process as much as possible. I know it's never an enjoyable process, but at least it alleviates some of the stress that can contribute to the decreased success rates, because stress interferes with your reproductive function. So the more comfortable you are about at least our part of things, the less stressed you are about it, and the more likely you are to be successful.
That's why I love you so much, because you look at the patient holistically, but you also are very conscious about that communication protocol, because part of what happens within my coaching is really helping my clients communicate effectively to their physician. Yeah. And it starts with that relationship of trust. So I think it's wonderful. So let's talk about specifically, like after the transfer, the client or patient's in that 2-week wait, what would you recommend as one successful thing that they can do?
Yeah, this is, I cannot imagine how difficult this is for patients. The good news is it's a little bit less than 2 weeks, so if that makes it any better, but it's still extremely stressful. Every single moment, every single symptom you're feeling. Oh, I'm having a little bit of cramping. Oh, I had a tiny bit of spotting. Oh, I'm nauseous. My breasts are swollen. Oh, they're not swollen anymore. Every single thing that you're experiencing, I'm sure you're hyper analyzing and trying to figure out, am I pregnant or am I not? And of course, then you fall into the trap of taking pregnancy tests when it's too early, or I am in several support groups online for patients, and they, unfortunately, I feel their pain when they send out these pictures of their pregnancy tests, and they say, what do you guys think? Is this positive? I'm due for my test in 2 days. Should I be testing now? So, my advice, if I could just push a button and make you just not think about this, that would be the best thing you can do, but clearly it doesn't work that way. It again goes back to you shouldn't be dealing with stress, and you shouldn't be dealing with these difficult decisions and processes for the first time during your 2-week wait. That's why we work together from the beginning to help give you these tools. You're not going to be completely stress-free during that time. I think there's nobody who never thinks about, will my result be positive after everything I've been through? Right. But at least figuring out how you best deal with a stressful situation, how you and your partner, if you're with partner, can work together on this. Do you have a little ritual that you follow that helps you feel better? Do you increase your, your exercise routine or your shopping therapy or whatever it is that makes you happy? Obviously, you shouldn't go bankrupt in these 2 weeks, but whatever makes you happy and just helps you keep your mind off of it as much as possible. My advice I always give patients is there's no symptom that means anything. Absolutely, you should not interpret any of your symptoms as good or bad. And you should, I know it's very difficult, but I place one partner responsible for the other. You should not do a pregnancy test at home. The time that we schedule you to come in for a blood hormone pregnancy test is the absolute earliest that it would be positive. And the blood test is always more sensitive than the urine test. So you should not be checking at home. Don't fall into that trap. I know it's very tempting, but just don't do it, because it's going to generate more questions, more confusion. Just let us do it. We don't want you to wait either. So we schedule you as soon as a test would be positive, as the test would be detected positive in your blood, you're scheduled for a test. And again, if questions come up, you should feel free and able and comfortable to talk to your physician and your nursing team and call and say, this is what I'm experiencing. Is this normal? And part of the education means that I have already told you what you should be expecting.
Right.
So you're not surprised by anything.
Right.
So it's probably the most stressful time, because it's every other time in the process you're physically doing something. This is the time where you just sit and wait.
But you know what? For me, I always think it's the most important time to do nothing.
Right.
And to look at it as this might be the only last 2 weeks that you're only either a family of 2 or a family of 1. Like this is the last 2 weeks of that. You're between 2 worlds.
Right.
And what are you going to do during those 2 weeks to make those memories?
Right. No, I know it's so difficult. I mean, it's difficult for women who are trying on their own with no infertility, let alone for somebody who has been through so much to make it to this point. And of course, everybody's hopeful that it's going to work. It doesn't unfortunately work for everybody every single time. But it's probably one of the most difficult times, which is why, again, having established a relationship with your physician and your team at your fertility center, with a therapist potentially, with a coach, somebody that will support you and or have taught you how to be psychologically strong and independent during that time is so important.
To create that resilience, right?
Exactly.
We're talking about emotional, physical, spiritual resilience to get to this time.
Yeah.
Because there's a beginning, a middle, and an end, and you're coming to the end of this cycle. So
Right, exactly, right. And thinking about, some patients cope with it about thinking, there's the patients who need to think that this is going to work, and I'm not going to think of anything negative until I actually hear that this is the case. So, and there's the patients who say, this is not going to work, let's plan for the future. And I am no longer trying to change either one of these approaches. It is what works for you. Some people need to do one thing, some people need to do another. Whatever makes you feel comfortable is fine. Just try not to interpret any physical signs, because they mean nothing other, of course, than any sort of, in those 2 weeks, there wouldn't be anything that would indicate anything one way or another. So just be patient, which is so easy to say, of course, but as you said, try to do as little as possible thinking about this process, and stay positive as much as possible.
Well, I absolutely appreciate everything that you shared. And how would someone get a hold of you now? What would be the best way? Through the information underneath the video, or?
Yes. So the information underneath here, our website is CCRMIVF.com. And our phone number here in Northern Virginia is 571-789-2100. I also have a professional Facebook page, which is Dr. Moragianni, Fertility Specialist, and you can send me a message there and call us. They can contact me through you. We're always available to answer questions and help you in any way in any way that we can. This is a difficult process, but we're here for you.
Thank you so much. I so appreciate you.
Of course. Thank you for inviting me. This is always so much fun.
I love you. I can't wait to see the rest of this beautiful office behind you.
Of course. We can't wait to have you over. And of course, we're available for patients to tour our state-of-the-art, beautiful clinic as well.
Bye, honey.
Okay, bye-bye.